5 Shu Points is a group of powerful special points in the meridian and collateral system. They can treat both meridian and internal organs conditions. In this video, I am going to show you everything you need to know about 5 Shu Points. The first question is, what is 5 Shu Points? 5 Shu Points refer to 5 acupoints on each meridian of the 12 main meridians, which are strong in therapeutic effect and all are located distal to the elbow and knee. They are effective in treatment and convenient to expose, so they are widely and frequently used in the practice. The second question is, what are they? On each of 12 main meridians, from the tip of fingers or toes to the elbow or knee, there are 5 points which are the gathering point of the qi of the meridians. They are well point, spring point, stream point, river point, and sea point, indicating from the well point to sea point, the qi of the meridian is getting abundant and strong. Then how to use 5 Shu Points? There are 3 principles we need to follow. Principle 1, for excessive syndrome, the sun element should be reduced. For deficient syndrome, the mother element should be tonified. What are sun element and mother element? Let's quickly review the 5-element theory. In the generating order of 5 elements, the element generating this element is called mother. The element generated by this element is called sun. For example, wood generating fire and fire generating earth. In the perspective of fire, the wood is mother and the earth is sun. Then let's talk about principle 2. The well point pertains to metal in yang meridians, pertains to wood in yin meridians. From the well point on, the rest 5 Shu point, spring points, stream points, river points, and sea points following the generating order of 5 elements. According to this, the 5-element nature of 5 Shu points in yin and yang meridians are: yang meridians. Well, metal. Spring, water. Stream, wood. River, fire. Sea, earth. Yin meridians. Well, wood. Spring, fire. Stream, earth. River, metal. Sea, water. Principle 3, after calculation and analysis, the result point is well point. If we need to tonify it, we will tonify the sea point instead. If we need to reduce it, we will reduce the spring point instead. After knowing all 3 principles, there is still another choice we need to make when we use this theory. Do we select the point on the affected meridian or on the other meridians? What does it mean? Now let's see a case. For example, we have a patient having heart blood deficiency syndrome. She will be having insomnia, palpitation, pale complexion, and tongue, thready and weak pulse. Then by using 5 Shu Points theory, which points we can use? Is it an excessive syndrome or deficient syndrome? Obviously, it is deficient. Now we will use the first principle. For deficient syndrome, we need to tonify the mother. In the case, the affected organ is heart, which is fire in 5 elements theory. The mother of fire is wood, the corresponding organ is liver. Now we can tell ourselves, we need wood. Where can we find wood? There are 2 places we can find wood. On the affected organ's meridian, there is point pertaining to wood. And we can also use the wood point on the wood meridian. This is very important. We must use the wood point on the wood meridian, not other meridians. This is the choice we mentioned before. Do we select the point on the affected meridian or on the other meridians? Let's move on. If we are going to use the point on the heart meridian. Heart meridian is a yin meridian. According to the second principle, the well point is wood, the spring point is fire, the stream point is earth, the river point is metal, and the sea point is water. In this case we need to tonify the wood. So the well point is the target point. But it is not the end. We have principle 3 to follow. If the target point is well point, we need to tonify it. We are going to use sea point to replace it. So the final point is sea point of heart meridian, which is HT3. If we choose to use other meridian except heat meridian to treat, remember what we need. We need the wood point on wood meridian. Wood meridian is liver, liver is een meridian, the well point is wood. Same thing, if the target point is well point, and we need to tonify it, we will tonify the C point instead. The C point of the liver meridian is LR8. So the answer for our practice is: the point on the affected meridian is HT3. The point on the other meridian is LR8. Okay, that's it for our discussion on the 5 shu points. I hope it all makes more sense now and that you found it helpful. If you have any questions, feel free to leave a comment below, I'm happy to help. I'll be sharing more insights on traditional Chinese medicine and acupuncture, so if you like this video, please subscribe and stay tuned. Thanks so much for your support.